Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, in the systemic lupus nephritis, then hematological features. If you see the hematological features of systemic lupus erythematosus, in the hematological patients, the patient will have Coombs positive hemolytic anemia is seen in the patient. Okay, Coombs positive hemolytic anemia is seen in the patient. There is even destruction of platelets destruction of WBC resulting in leukopenia. There can be destruction of platelets resulting in thrombocytopenia. There is even antiphospholipid syndrome is also associated with this SLE. In antiphospholipid syndrome, lupus anticoagulant antibody will be positive, and even the anticardiolipin antibody is also positive. And in antiphospholipid antibody syndrome, this mainly consists of thrombocytopenia. The patient can have recurrent fetal loss, and the patient can also have recurrent venous or arterial clotting will be seen in antiphospholipid antibody syndrome. Actually, in the SLE, there is one thing which occurs. In the SLE, there is autoimmune destruction of RBC, autoimmune destruction of RBC, WBC, platelets are seen in the SLE mainly due to the warm antibodies. Actually, warm autoimmune hemolytic anemia is associated with SLE. Warm autoimmune hemolytic anemia is actually associated with SLE. And thus, because of this autoantibody destruction of WBC, RBC, and platelets, the patient will develop pancytopenia. That is, decreased RBCs, decreased WBCs, and decreased platelets are seen. So, the treatment of such case is high dose of corticosteroids are administered to the patient.
thank you and thank you for watching.